Yeah, no problem. I'm glad to be here. So yeah, this will be, an overview, kind of what the leave, the benefits look like, as well as the employer responsibilities. And then we are in the third quarter reporting, so we will kind of give a refresher on what the reporting process looks like as well. If you have a question, Rebecca, is it best to take questions in the chat, or how would you like to do that?
Yeah, if you have questions, sending them to me in the chat is great. And that way, if I don't have a direct answer, I have it written down so that I can get back to people individually.
Okay, yeah, and that being said, if you ask a question and I don't know the answer, I've been with the department about 5 months today, actually. So if you ask a question that I don't know the answer to, I'll kind of do the same thing. I'll take it back and I'll get the answer, and then I'll send it out to the organizers and make sure everybody gets the right information. So with that being said, we'll go ahead and get started. Just to kind of give you some framework here, this is rolling out in phases, paid family and medical leave. This year, employers have the responsibility of collecting and remitting premiums, as well as reporting wages and hours worked for their employees. And this started in January of 2019 with the first paycheck. First and second quarter reporting were done in July and August, and now in October we are doing the third quarter reporting. And then starting with January of 2020, January 1st, workers will be able to start claiming the benefits. So very quick timeline, but again, we're doing it, rolling it out in that phased approach. And so today we're going to spend most of our time talking about employers and the responsibility, but again, I wanted to start with the benefits of the program. Even though employers are not required to administer the paid family medical leave benefit, we know that you're often the first resource when you have an employee that would like to utilize a leave. So we want to give you a good idea of how this benefit will work starting in January of 2020. So paid family and medical leave is two different kinds of leave. There's family leave and medical leave. Family leave could be time to care for a qualifying family member. This could be the birth or placement of a child, which is sometimes called parental leave in other programs. This could also include military exigencies, and that's so family members of an active duty military member have time to prepare before they're called to serve or spend time together after they do return from a deployment. Medical leave is care for yourself when you experience a serious health condition. In other states, this is sometimes called short-term disability or temporary disability. So now we'll go a little bit deeper into the qualifying events. So again, medical leave is care for yourself. This is time to recover from a serious health condition. Medical leave could cover things like back surgery, recuperating after a terrible auto accident, or being treated with chemotherapy after a cancer diagnosis. It's important to remember that an employer is not responsible for validating these medical conditions. The worker is responsible for applying for benefits directly with the department, and they are also responsible for getting necessary medical validations. They'll get those signed by a qualified medical professional, and then they return those forms directly to the department. Again, these are not the employer responsibilities to validate any of those things. So family leave could be bonding time after the birth or placement of a child. This could also include adoptions and foster placement. Bonding time is special in that you have the first year after the birth or placement of the child to use the available leave. And this is available to both parents. So a lot of times we get questions about babies born in 2019. So the parents of babies born in 2019 would be eligible for paid family medical leave after January 1st of 2020. They would have until the baby's first birthday. So if a baby was born today, they would have until October 15th of 2020 to use the leave, up to 12 weeks. And again, both parents would qualify as well. Family leave is also available when a family member experiences a serious health condition. So this could be a family member has chemo treatments every Friday, and you would like to take the family member to those appointments, so you could use paid family medical leave potentially for those instances. And notice how I said every Friday, so both family leave and medical leave can be used intermittently, so they can be used 1 day a week, 2 days a week. They can be used on that rotation. So again, it is available intermittently. So want to really stress, and you'll hear me say it a few times today, that a lot of the responsibility is on the employees. So again, verifying the medical condition for a family member is done by a medical professional, and the employer is not responsible for validating that medical need. Again, it's the responsibility of the employee. And you can see here that the definition of family for paid family medical leave is similar to that of FMLA's, but it is a bit broader. On the left side there, you'll see that paid family medical leave's definition includes children, grandparents, in-laws, and step relationships. On the right side of the screen there, you'll see that aunts, uncles, cousins, roommates, distant relatives are not covered. And you'll notice at the bottom there, pets are not included, even though we do consider them to be parts of the family, members of the family, they are not included in paid family and medical leave. And I mentioned it earlier, but a military exigency is another potential leave. This broadly relates to deployments and the preparation before and recovery after a person has returned from a deployment. It's the family of the person being deployed could use paid family and medical leave to spend time before a deployment or when the person is back on R&R leave, or when they do come back after the deployment is over. And it's important to note that the person being deployed is a federal employee and may not qualify to use paid family and medical leave if they do not have additional employment outside of their federal employment. One of the exemptions for paid family medical leave is employees of the federal government. Another one is employees of federally recognized tribes, and the other are self-employed people. Those are the only exemptions from paid family and medical leave. Okay, so I mentioned taking leave, medical leave or family leave, when you have a serious health condition. And the definition of a serious health condition is important, and it is defined in our statute, and I won't go into details today covering exactly what the definition says, because validating a medical condition is not the employer's responsibilities. That said, I do want to give you an idea of what it is included and what isn't. Generally, a serious health condition is going to be a serious health condition, a chronic serious health condition. This could also include mental health conditions, substance abuse treatment, and other things as well. So generally, again, it's serious chronic health conditions. These aren't going to include the common cold, flu, earaches, upset stomach, ulcers, headaches other than migraines, and cosmetic treatments. These conditions, again, are validated by a doctor and are then submitted to the department by the employee. Completing this paperwork is the employee's responsibility, not the employer's. And the doctor is also going to be certifying the amount of leave, and we'll get to leave here on the next slide, or in a couple of slides, but do want to stress that the doctor is going to be validating the amount of time a person needs to be on leave. So again, we'll hit that here again in a few slides. So in order for a worker to be eligible for paid family and medical leave, they must work 820 hours in the qualifying period. The qualifying period is a year of time, so they must work 820 hours in a year. Now, technically, the qualifying period is either the first 4 of the last 5 completed calendar quarters, or the last 4 completed calendar quarters if the worker doesn't qualify in that initial period. Verifying a worker's eligibility is also the responsibility of the department, not the employer. We're going to base this on the quarterly reports that the employer submits to us, and that's how we're going to determine the eligibility. And it's also important to note that these 820 hours could come from more than one employer. If a worker worked 10 hours a week at a coffee shop and 10 hours a week at a grocery store, they could earn their 20 hours a week towards their eligibility. And if you do the math, 820 hours divided by 52 weeks in a year, a worker would have to work a little over 15 hours a week on average in the qualifying period. And kind of a little bit more breakdown there on the screen. If you work 20 hours a week, you'll get there in about 41 weeks. And if you work 40 hours a week, you'll get there in 20 and a half weeks. But again, the main takeaway from this slide is all the hours count, even if they come from multiple employers. All those hours add up to their 820 hours, and we use those quarterly reports to determine the eligibility of an employee. So the amount of leave available to a worker will generally be 12 typical work weeks. Most people will fall into that 12 weeks of family or medical leave. If a worker experiences both family and medical leave events in a single year, they could have access up to 16 weeks, typical work weeks of leave. And the statute does add 2 additional typical work weeks when a worker experiences complications related to a pregnancy. So to kind of go back over that, so generally everyone will fall into that first category of 12 weeks, up to 12 weeks of family or medical leave. So if you have a serious health condition, potentially up to 12 weeks to care for yourself. If you have a family leave type of situation, that would be 12 weeks. If you had a family and a medical leave in the same year, you could get an additional 4 weeks, which would get you to 16 weeks of family and medical leave. And again, additional 2 weeks for complications related to a pregnancy. So that bar is even higher. This could be bed rest prior to the birth of a child. So this is where the doctor certification comes in. So you would have up to 12 weeks. So let's say I was in a serious auto accident and I needed to be off for 6 weeks. The doctor verifies 6 weeks, and that's the amount of time that my leave. Just because I have 12 weeks doesn't mean I'm automatically getting 12 weeks of leave. It's going to be based on the doctor certification. If I needed an additional week, I would have to get recertified from the doctor and have that doctor certification submitted to the department. So again, just because you might qualify for up to 12 weeks doesn't mean that you're going to get 12 weeks. It's going to be based on what the doctor certifies. And these are weeks available in a claim year. So this is not January to January. We're not doing a calendar year. We are doing when you submit a claim and then follow the following year. So if you submit a claim on February 1st of 2020, your claim year would be February 1st of 2021. So you would have 12 weeks in that claim year. So again, not a year on the calendar, but a year from when you file a claim going into the following year after that. And 2 more important notes about leave duration. The minimum claim duration is 8 hours, so you can't use paid family and medical leave if you intend to take less than 8 hours of leave. And there's also a week-long waiting period in statute. Okay, and so when a worker has a qualifying event, meets those 820 hours of eligibility, and they go on leave, they will receive a proportion of their normal weekly wage. And this will range from $100 to $1,000 per week and will be on average about 70% of the worker's typical weekly wage. Those who make less than half of the state average weekly wage will get 90% of their typical weekly wage. So that formula is set in statute. And so I believe the typical weekly annual salary is around $65,000 for Washington State. So if you meet that number, you'll typically get 60 or 70% of your typical weekly wage. And if you make less than half of that, so around 30, 33,000, you could qualify for up to 90%. So those numbers here on the right kind of break it down. So $500 a week is your normal weekly wage. You potentially would get $450, and we do cap it at $1,000 per week. That is the cap of the benefit payment. So employers can also offer to pay supplemental benefits, or they could top off their employees. So if they have an employee who is on leave, they can use paid time off to supplement, top off that 30% to make up that difference to get them whole. Again, that's called supplemental benefits, and phase 6 of rulemaking is addressing that more, so stay tuned. But do want to just throw that out there that employers can choose to pay a supplemental benefit, and the employee can choose to accept it. And then, so if they're making, say, 70% while they're on leave, the employer could use paid time off to make up that 30%. An online benefit calculator is in development, and we'll have that by the time the year ends, and that'll give people an idea of what to expect when they are going out on leave. Okay, so we've kind of gone through the details of what the leaves are, what qualifying events, how the benefits work. So let's talk about how the leave cycle is going to look. So the first two important things for an employee taking leave are they must work those 820 hours, and they have to have a qualifying family or a qualifying medical leave event. When a leave event is foreseeable, the employee must give their employer 30 days notice before they intend to take leave. So this would be if you have a planned surgery, if you have the birth or placement of a child, those are foreseeable events. You have to give your employer 30 days notice. When it is not foreseeable, the employee may still be eligible for leave and can file their claim after the event has occurred. So this would be if you were in a serious auto accident and you were in the hospital for 8 days, we don't want the first phone call or the first thing you do after a serious auto accident is to apply for paid family medical leave. So you can apply after the event has occurred. Key thing here, using paid family medical leave is the employee's choice. So the employer cannot dictate that the employee uses their sick leave or their vacation leave before they access paid family medical leave. It is the employee's choice. So there may be instances where using vacation or sick leave would be a better choice for the employee. So let's say they were having surgery and the doctor certified 2 weeks and they had 2 weeks of sick time, and that would be 100% of their pay. So they never apply for paid family medical leave, they use their sick leave, or they could apply for paid family medical leave. The key thing here is that it's the employee's choice. The employer cannot dictate that they use up their vacation or sick leave before they utilize paid family medical leave. So let's say they qualified, they have a qualifying event, they're eligible, work the 820 hours, they gave the notice. They would submit a claim to the Employment Security Department. We are going to validate that they've worked the 820 hours, and we're also going to look at the medical certification that they've supplied to us. If we have additional questions, we may follow up with the employee or the employer. The employer will receive notification that the employee has submitted an application, and they'll also receive notification when the employee's claim has been accepted. So the employer will be communicated directly by the department to the employer. So they'll file their claim. Let's say it's approved. If the claim is approved, it could be denied. If the claim is approved, they'll start their leave, and then they'll have to file weekly or bi-weekly claims to claim their benefits. So on this form, on this process, they'll have the ability to say if anything's changed, if they're still on leave, or if they've gone back to work. Again, the leave can be used intermittently. So if they work Monday, Tuesday, Wednesday, and Thursday, Friday, they had chemo treatments, they would indicate that on their form. So they would do that weekly or bi-weekly, and then assuming they either run out of leave or their leave event is done, they no longer need to be on leave, they return to work, and then they return to work. And they have job restoration, which we'll talk about here on the next slide. So employment restoration is part of paid family medical leave. It's similar to that of FMLA. So an employee has job protection when they've worked for the employer that has 50 or more employees for at least 20 weeks, has worked for that employer for at least 1 year, and they've worked 1,250 hours for that employer in the last year. So if all three of those things are true, the employee has job protection or job restoration. And when they return to work, they must be given the same or equivalent position when they return from their leave event. And just a couple of quick things to add in here. If an employer is a small business, so under 50 employees, there are grants that will be made available. This would be up to $3,000 to offset the cost of having an employee out on leave or hiring a person to replace that person while the employee is out on leave. So stay tuned for those small business grants. Also, we get asked a lot of questions about how paid family medical leave interacts with FMLA, which is a great question. In the statute, it does say FMLA and paid family medical leave should be run concurrently. However, that may not always be the case. So it is possible that an employee could use FMLA, use up the leave there, and then apply for paid family medical leave. So that is a possibility. So FMLA is very similar to paid family medical leave, but we are different and we are a distinct program. FMLA is unpaid, paid family medical leave is paid. So we can follow up with questions around that after the presentation. So now let's talk about some of the employer responsibilities. So this began, again, with the first paycheck of 2019. Employers should be withholding premiums from their employees. Employers will then report hours and wages quarterly to the department. July and August was quarter 1 and quarter 2. We are in quarter 3 right now. So these wages and hours are submitted quarterly to the department, and then employers will have responsibilities of notifying their employees. The department will supply a poster to employers. We'll do that before January of 2020. And we'll also, the employers also have the responsibility of, if they have an employee who is out on leave for an event that could qualify for paid family medical leave, they must notify their employee that they could qualify for paid family medical leave if they've been out up to 7 days. So that is another notification requirement. So employers are responsible for collecting premiums for paid family and medical leave, and an employer can choose to pay the entire premium on their own, or they can collect up to 63.33% of the total premium from their employees. And the premium is assessed on gross wages, so we'll talk more about gross wages here. Gross wages include, but are not limited to, salary or hourly wages, sick leave, vacation leave, holiday pay, bereavement leave, and paid time off, any bonuses, stocks as part of a compensation package, and the cash value of meals and lodging when they're given as compensation. Things like reimbursements are not wages and wouldn't be included in gross wages. So the key thing here is likely to be different from unemployment, is that wages are not included. Tips are not included in gross wages. And you also may be familiar with our state's unemployment insurance program and the exceptions that are in that program, like for corporate officers. So it's important to understand that the exceptions from unemployment insurance do not apply to paid family and medical leave. So you may have some employees who would not be included in paid family and medical leave, but they're included in UI or vice versa. And premiums are capped at the Social Security wage base, or the Social Security cap. That was set at $132,900 in 2019. So at that point, once an employee goes over the $132,900 cap, the premiums are no longer assessed on anything above that amount. So withholding from paycheck stops at that amount. It's important to note, though, that those employees who do go over the cap should continue to be on your quarterly report. So compensation can sometimes be complicated. So if you have any more questions about gross wages, you can call or write our customer care team, and you'll have that contact information at the end of the presentation. So this all might be a refresher for you. Again, it's important We do have Q3 going on reporting right now, so just kind of want to give a refresher on that. So you may be familiar with how premiums are calculated, but again, this is just a quick refresher. Our statute divides the total premium into family and medical portions, and then it further divides those portions into employer and employee portions, and this can seem complicated, so it's been reduced down to 2 steps, and you'll see those on the slide. You'll calculate the gross wages times 0.004, that gets you the total premium, and then to figure out what the employer portion is, you multiply that total premium by 0.3667 to get the employee portion, take the total premium times 0.6333, and that'll get you the number that you withhold from that employee's paycheck. It's important here, if you have fewer than 50 employees, you do not have to pay the employer portion. So for these small businesses, their portion of the premium goes away. It is not transferred to employees or anyone else. These businesses are simply not assessed the employer portion of the premium. They are only assessed the employee portion. Now, if you haven't withheld premiums from employees up to now, you can begin at any time, as long as you give your employees 1 pay period of notice before you start withholding those premiums. As an employer, you cannot collect missed premiums in later pay periods, and the employer is responsible for paying those missed premiums. You can't go back and collect those missed premiums from your employees. So we just talked about how businesses with fewer than 50 employees don't have to pay the employer portion of the premium. Business size, as it relates to calculating premiums, is done once a year. And in a typical year, the department will look at reporting done throughout the year. And then on September 30th, we will average the number of employees over the 4 quarters. So in the example you see here on the slide, the business averaged 60 employees throughout the year. So for paid family and medical leave, this business has 60 employees. Next year, the average will be recalculated, and this business may have more or less employees at that point. So business size changes only once a year, and it's at the beginning of the year. And it's important to know that this is a head count, so you are reporting both part-time and full-time employees. We are not using full-time equivalent or any other method of calculating employees in paid family and medical leave. Again, this is strictly a head count. 2019 is a special case when it comes to calculating premium business size. Since this will be the first year of reporting, we have used the first quarter report to determine business size for this year. Next year, we will recalculate using first and second quarter reports for 2019, and we'll get the 2020 business size, and this will be the only time that we do it this way. So again, 2019 is a special case. Okay. So we'll talk about reporting. Again, this will be a summary here, kind of a refresher. Reporting for paid family medical leave, again, began earlier this year. If you've had trouble reporting, happy to help you by calling or emailing the customer care team. Trying to troubleshoot the reporting process is difficult to do in a webinar. So if you have specific questions about the reporting process or issues you might have had, it'd be a great avenue to contact our customer care team. Again, we'll have that contact information at the end of the presentation. So reporting is done through Secure Access Washington. So you log into Secure Access Washington, also known as SAW. And when you get into your SAW account, you go to Add a Service. You find Paid Family and Medical Leave under the Employment Security Department, and then you add that Paid Family Medical Leave to the list of your services in your account, and you will then see Paid Family Medical Leave on your SAW dashboard. To access Paid Family Medical Leave, you would click the link, and that will take you into the Paid Family Medical Leave site. You'll create an account. So when you set up your account, you'll need your UBI number, your business name, and contact information to create that account. There are 2 kinds of accounts there, employers and employer agents. Employer agents should only create an account for themselves. If they have employees in Washington, they should not create employer accounts for their clients. Employer agents would be a third-party administrator, so they should not be going in and creating accounts for their clients. We will need to verify your information when creating an employer account, and so we do this by sending a PIN to the address that we have on file, and the system will generate that PIN, send it to you by mail in 3 to 5 business days. When that PIN arrives and you validate your account, that will get you full access, but you will immediately have limited access where you can file reports and make payments with your account, again, before you complete that PIN process. It is important to complete that PIN process, though, even though you have limited access in the meantime. When verified and you have full access, you can delegate access to other users, see past reports, and other features. So again, it is important to complete that process. On this slide, you'll see what we're asking employers to report. These are wages and hours that are in the quarter and other identifying information about your employees. Wages and hours are reported in the quarter they are paid, and this can sometimes be confusing if you have a pay period that includes the end of one quarter and the beginning of the next. The easiest way to know which quarter to report them in is simply to use the pay date. If the wages are paid in the second quarter, you report them in the second quarter along with the associated hours. And so please note that paid family medical leave reports are similar to unemployment reports, but they will be an additional report that is filed separately. Paid family medical leave report does not replace your unemployment insurance report. And there are 3 options when you want to report. You can manually enter your employee information, and that'll be available for employers with less than 50 employees. The second option is single entry, and this is likely to be the most common, and it's done by uploading a spreadsheet in the specified format, and the spreadsheet has your employees' information. This method will be using the CSV formatted spreadsheet, and you can find that template and specifications on our website. Employer agents, third-party administrators will be able to use all those methods, but they'll also have the option to bulk file using ICESA. This allows them to upload a single file that has many UBIs, so they can upload that single file and report on behalf of many clients that they have. If you report for more than one UBI, but you are not an employer agent, you will use the single filing option. You'll create a different CSV spreadsheet for each UBI and upload it to that account. All this information is on our reporting page. We'll have that again at the end of the slide, but again, all this information is there and available. We also have tutorials on our reporting page as well that will walk you through step by step. So if you found that you made an error in your report and you need to fix it, you will submit an amendment. To submit an amendment, you would upload the entire report again with the corrections that you need to make. Your amended report will replace all data that you've entered previously for your UBI. You can't simply add a single employee or change one employee's hours. You must resubmit the entire UBI's information with the corrections and additions or subtractions. And remember that reporting is done by UBI, so this could be an issue if you have more than one person reporting for the same UBI. Employers will need to coordinate reporting for a single UBI so that a second report that is meant to add information doesn't amend, or in other words, replace a previously submitted report. And all data for a single UBI should be submitted in a single file. If an error has occurred, an error report will be available under the wage submission history page under the wage reporting tab. And if something doesn't go right as you expect, the error report is a good place to go and find out what the issue was. And the schedule for reporting and remitting is the same as unemployment insurance, except for the first and second quarter of this year, which was done in July and August. So on this screen, you can see that you have the month following the end of the quarter to submit your report for that quarter. So for September, you have until the end of October to submit your third quarter report. And just to kind of reiterate, employers do have notification requirements for paid family and medical leave. The first requirement is a workplace poster. The department will develop this poster. They had a meeting going on right now to implement that and get that sent out before the end of the year. And employers will be able to find it on paidleave.wa.gov again later this year. Employers will also be required to notify their employees of paid family and medical leave if an employee is on leave for reasons that could be covered by the program. And we will have more details about this notice later in the year as well. As I said, we are rolling this out in phases. Phase 6 of rulemaking is going on now until the end of the year. So that's why some of these things I say have the tagline of stay tuned. And so this is one of those things. So we have more webinars scheduled now and throughout the year. So if you want to attend another webinar, or you know somebody that needs to know this information, you can find that there on our events page. We also have an employer toolkit. You can find that toolkit at the employer page of our website. In this toolkit, you'll find details about the employer responsibilities that I've talked about today. You'll see a readiness checklist and a pay stub insert. The pay stub insert is a document that you could print and include with your employee checks to alert them of this new program, and it does come in many different languages. And again, you'll find that in the toolkit on our employer page. And we have ongoing rulemaking. Again, phase 6 is going on right now. You can go to our rulemaking page of our website to participate in that process. And here's where you're going to find what's proposed in current phases of rulemaking, and also what has been considered in previous phases of rulemaking. And this here is our customer care team, our fantastic customer care team. This is their contact information. You can give them a call, email. They are very knowledgeable and happy to help, and they can provide any clarity, any assistance, or help in any way. So do reach out to them if you have additional questions. Speaking of questions, we have just over 15 minutes, and so I am happy to take questions.
Brennan, can you see the questions pane in the webinar, or do you want me to just read the questions to you?
I can see. Let's see. Yes, I can see just the one question in here so far, if I'm seeing it right.
Nope. So the first one that popped up was, do holiday, vacation, paid time off, and sick hours count towards the total hours worked?
Oh, sorry. So yeah, so the sick leave, vacation leave, holiday pay, bereavement, any paid time off, bonuses, all that are included in the gross wages. They would be included in the report, in the quarterly report. Really, the only things that would not be included are things like reimbursements. And so, yeah, to answer that question, vacation, holiday, bereavement, paid time off, bonuses, they are all included and would be on the report.
Okay, and this one is, if employees work 2 jobs, will they be eligible or qualified to be able to obtain paid medical leave from both employers, or is it whichever job provides them the most hours?
Okay, yeah, so that goes to that eligibility of 820 hours. So let's say they're working 2 jobs, all those hours are going to add up. I think the key thing to remember here is that they are being paid by the department. They are not being paid by an employer. So while they're on leave, they are not receiving any sort of pay from an employer. So as far as what was the second part of that? They would go with who pays the most. Is that right?
No, whichever job has the most hours. As far as reporting, like are both employers claiming this employee and reporting, and therefore the employee is qualifying with both employers?
I see. Yeah, so the way that that's going to work is that the hours and wages that an employee works are going to be averaged on the typical weekly wage. So I think that that's probably the most important concept here. So if an employee's typical, even between 2 jobs, adds up to, let's say, 20 hours a week is their typical work week, when they go out on leave, that's going to be their hours, is going to be that 20 hours of typical weeks. It's going to be an average based in that qualifying period, just like the wages are going to be average in that qualifying period. So if we look back a year from when an employee applies, we're going to take their 2 highest quarters of that year, and that is what's going to be used to base their benefits payment on. So it's not like an employee works 20 hours a week and then they qualify for leave and they're going to have 40 hours a week. We're going to look back and look at their what they typically worked in that qualifying period. And if that number was 20, even if that was between 2 jobs, then when they are on leave, it would be based on that 20 hours a week. And again, that would be the same for their pay as well. It's going to be an average from that qualifying period, which is the previous year.
And then this one, I think you may have answered it a little bit, but are employees allowed to use their sick leave or vacation leave to make up the difference in wages if they're taking the paid family and medical leave?
Yes, so this goes to that supplemental benefits portion here. The key thing is that the employer can choose to offer supplemental benefits. They are not required to. So if you have an employee who goes out on leave and you would like to offer paid time off as a supplemental benefit, that is your choice. It is also the choice of the employee to accept it. They don't have to, but yes, so assuming that the employer offers it and the employee accepts it, they could use pay time off to make up the difference from what they are receiving when they are on leave.
So just to clarify, if an employee already had built up time off, the employer still has to approve that they can use it at the same time. So it's still up to the employer.
Yeah, so if you have, a bank of hours, let's just say you have a week of sick time, and you as the employer do not want your employee to be using any supplemental benefits, you would simply not offer it. If the employee has a bank of hours and they qualify for paid family and medical leave, I'll just kind of make up a scenario here, but let's say for some reason they wanted to use a sick day on Monday and then use paid family and medical leave for Tuesday, Wednesday, Thursday, Friday. When they submit their weekly or bi-weekly claim, it would say what hours are you claiming paid family and medical leave. They would not claim Monday because they took paid time off. So you couldn't double dip in that way of claiming paid family and medical leave and also claiming sick hours or vacation hours. You would have to indicate that you used a sick day that day and then claim paid family and medical leave for the other days.
Okay. Next question is, you mentioned using leave every Friday for medical appointments. How would that count for the 12 weeks?
Okay, yeah, good question. So yeah, you can use paid family medical leave intermittently. So in that example, medical leave, let's just say a person has a baby and they have a babysitter for or childcare for Monday through Thursday, and on Friday they want to take the day off to spend with their child. Again, they would have to coordinate this with their employer. Employees still have to abide by the employer's notification and attendance policies. So it's not just I don't show up and there's no repercussions. They still have to abide by the attendance policies. So let's say the employee here wants to use Fridays to take care of the little one. So they would have to use the entire Friday. That's that minimum 8-hour claim duration. They would have to use an entire 8 hours. So if they normally worked a full 8-hour shift, that would be 1 day. If they work 2 4-hour shifts, they would have to likely miss multiple shifts. So they would use the 8 hours. And the way to look at this is a bank of hours. And so I think that this goes also back to that point of it's going to be based on their typical typical work week. So if their typical work week, and we look back and we average it and we find that it was 20 hours a week and they use 8 hours for that leave on Friday, that would count, that would be subtracted from their bank of hours. It wouldn't be based on 40 hours a week, and so they would take a Friday in that instance for the next 52 weeks, or whatever the case may be. We're going to average it on what your typical work week hours are, and then when you submit a claim, it'll be deducted from that bank of hours what your typical work week hours were.
Okay, next question is, how does, or they're asking about a short-term disability benefit an employee may have with their medical benefits. Like, does this affect that?
Okay, yeah. So a company may offer, their own short-term disability plan, and that is totally fine. In short, that really doesn't affect paid family medical leave. An employee could go out on a short-term disability plan. So let's say a company offers 6 weeks for pregnancy, for the birth of a child. So an employee goes out on that and then applies for paid family and medical leave. That is totally possible. Short-term disability plans could also offset, do that supplemental benefit portion that we talked about. So, typically short-term disability plans are, up to 60%. So let's say they're getting 60% on the state plan. The short-term disability would offset that to make them whole. So they would do the 40%. So that's one option. But again, the key thing here is that a company short-term disability plan does not affect a person's usage of paid family and medical leave.
This says, I may have missed this at the beginning of the webinar, but employees who are salaried, do they have different qualifying rules?
No, they don't. The only thing would be how they're reported. Salaried individuals may work more than 40 hours a week. So let's say they work 60 hours a week. For salaried employees, you would just report them as working 40 hours a week, regardless if they work more hours than that. So other than that, that is the only real difference or key thing to note about salaried employees.
When the weekly claims get submitted for someone on paid medical leave, to prevent the double dipping you mentioned, does paid leave contact the employers to confirm and accept the claim? In other words, if they took sick leave on Monday but filed the claim for Monday through Friday, does that get monitored by ESD?
That is a good question. The features for the claim application, as well as the weekly and biweekly claim submission process, are still being worked out. I will say that an employee is verifying. So let's say they are qualified for leave, and that's what they go out on, and they are out for a complete week. They file the claim, everything's good, and then like the next week on a Monday, they take a sick day. And then the rest of the time they use paid family and medical leave. And then when they file that following weekly claim, it'll have that indication of, has anything changed? Have you returned to work? Have you used any other time off? And so if they do say nothing's changed and they claim paid family and medical leave for the same date that they use sick leave, they are subjected to potential, perjury and possibly repercussions legally from the Employment Security Department. As far as will we be calling the employer to verify that? No, but certainly there are going to be abilities to contest the claim for the employer if they know an employee has used this or has a dispute of a claim. In this scenario, they can absolutely submit that. So there will be legal ramifications for lying or falsifying these documents. But as far as if they say they've done If they say they've taken a vacation or a sick day, or if they lie about that, we likely will not be contacting the employer to verify that.
Okay.